Today, we're gonna go through a quick fix for sciatic pain. Hey everyone, welcome back to the channel. If you are struggling with sciatic pain, stick around. We're gonna do a nerve mobilization to help you with that today. If you haven't subscribed, please subscribe to the channel. If you like this video, like it. If you don't like it, hit the dislike button. Go somewhere else, do something you do like. Yes, I also know my face is a little bit jacked up right now. That's what happens when you do jiu-jitsu and martial arts and you do hard things. Sometimes that happens. But I know all of you are here to get better and you don't really care about looking at a pretty face. You can do that somewhere else on the internet. So I'm happy you joined me today and let's get right into it. Today we're gonna go through sciatic pain because oftentimes if you've ever had sciatic pain, it can be super frustrating. It can even be debilitating at times and it's just really annoying to have. So I'm gonna give you a quick drill for that today. Typically sciatic pain will be classified as neuropathic pain, which means it has to do with the nerve. And you'll feel some burning, some tingling, maybe some shooting down the leg, particularly in that glute area or even down the leg, like I said, where some of those nerve pathways go. So we're gonna learn a nerve mobilization today so that if your nerve's entrapped or needs some stimulation or just some extra mobility, that we can take some pressure off it and hopefully get rid of your sciatic pain. What we're gonna be working on today is called the tibial nerve. So it branches off of your sciatic nerve and goes all the way down into your foot and does some sensory and motor work in the lower leg. So we're gonna work on that nerve today and mobilizing that to deal with your sciatic pain. As always, make sure you assess and you reassess before and after the drill. So assess your hip mobility, assess your pain level, so you can tell if the drill was useful for you and what way you did the drill was useful for you, and you can change and make adjustments accordingly. Then what I want you to do is take the side you're having discomfort on to start. You're gonna place your foot up on a bench or a chair or anything like that. And remember, when we're doing this drill, we don't want the intensity to be above a 3 or 4 out of 10. Any more than that, it's not productive, just kind of hurts and you could do some damage. So keep this more relaxed in that sense and just pay attention to what you're feeling. Okay, once you put your foot up on the chair or the bench, you're gonna pull your toes towards you and then you're going to tilt your foot away from you. So I'm not moving my hip like this, I'm actually tilting my foot away from me. So it's ankle eversion, technically. And then if you still need more to get to that 3 or 4 out of 10, you can pretend there's a broomstick on your waistband and you're going to actually bend forward and you can feel that tension kind of kick up. I keep my spine pretty straight when I do that. And then from here we have a number of different ways to actually move and glide the nerve. So you can actually use the ankle motion we started with, you can use the knee motion, bend and flex that. You can use your hip, so especially if you're having pain in the sciatic area, I would tend to use the hip and do internal and external rotation. So the more you actually turn your hip in towards your midline, you'll feel the tension kick up and then kind of go back down as you go out. As you do a couple of those movements, so do 3 to 5 with each joint, as you do those, you might feel that the tension starts to relax a little bit. You can kind of tilt your hips or flex your leg more and feel the tension go back up because we want to get back to that 3 or 4 out of 10, okay? From there, you can also use some different things like hinging more at your hips. That can be one movement. You can also use your neck. So I like to use the neck to help floss the spinal cord with folks if their spinal cord's tight or they have any restriction there. So the more you bend down, you'll feel the tension go up. And then as you extend, you'll feel it kind of relax. Try a bunch of those different movements. See what you feel the best with. See what gets you the best result. And then continue to vary it from there so that you continue to give different stimulation to your brain and you can continue doing the drill in a way that's impactful for you. So that was your tibial nerve glide to help mobilize that sciatic nerve. Reassess your range of motion, reassess your hip pain, see how it feels. If it didn't work well for you, you can try something else. You might try doing that nerve mobilization on the opposite side. There are plenty of other things you can try, like sensory work through those nerve distributions, different things for the spinal cord, different vestibular and visual work. So this is not the only thing to try, it is a thing to try. So it may help you, it may not. Your brain may need a different stimulus to decrease threat and therefore decrease pain. So make sure you keep trying things, be persistent, that's what counts. So thank you so much for joining me today. I hope you guys enjoyed that. I hope it was helpful for you. If you like this video, hit the like button. Subscribe to the channel so you don't miss any content. Comment below with any questions you have or any drills that you want to see, and I'll see you on the next one.